How do global efforts standardize status epilepticus management? Imagine a world where every person experiencing a severe seizure receives the same prompt and effective care, no matter where they are. That's the goal of global efforts to standardize how we manage status epilepticus. This serious condition, where seizures last longer than 5 minutes or occur back-to-back without recovery, needs quick and coordinated treatment. To make sure patients everywhere get the best care, leading organizations like the International League Against Epilepsy, the American Epilepsy Society, and others work together to create clear, evidence-based guidelines. These guidelines help doctors worldwide agree on what exactly defines status epilepticus and how to classify different types of seizures. For example, the International League Against Epilepsy updates its classification regularly, with the latest in 2025 involving experts from many countries. This helps clinicians speak the same language when diagnosing and treating. These organizations also publish detailed treatment protocols based on the latest research. They recommend starting with fast-acting medications like benzodiazepines, which are given as injections or nasal sprays, to stop seizures quickly. If seizures continue, second-line anti-seizure drugs are used, and in more stubborn cases, specialized protocols guide doctors on managing refractory or super-refractory status epilepticus. Hospitals adopt these protocols into clinical pathways, which are step-by-step plans that include medication doses, timing, and when to move a patient to intensive care. This ensures a consistent approach across different healthcare settings. Another key part of standardization is the use of continuous EEG monitoring. This involves placing electrodes on the patient's scalp to record brain activity constantly. It helps doctors detect ongoing seizures that might not have visible symptoms, especially in patients who are unconscious or have subtle signs. Continuous EEG guides treatment adjustments and helps prevent further brain injury. International guidelines recommend this monitoring for patients with ongoing seizures or altered mental states. Research collaborations across countries also play a vital role. Multicenter studies and networks, such as pediatric epilepsy groups in Italy and other nations, gather real-world data on how well treatments work and what barriers exist. These findings inform updates to guidelines and help ensure that care is consistent, safe, and effective worldwide. Education and training are also crucial. Global organizations develop materials, practical guides, and consensus statements to teach healthcare professionals the best practices. This ongoing education helps ensure that doctors, nurses, and emergency responders are familiar with the latest protocols and can act swiftly. While striving for uniformity, guidelines recognize that healthcare resources vary from place to place. They include adaptable recommendations that consider local medication availability and infrastructure, so that core principles of rapid and effective treatment are maintained. In summary, international efforts to standardize status epilepticus management relying on shared, evidence-based guidelines, clear seizure classifications, structured treatment pathways, continuous brain monitoring, collaborative research, and widespread education. These combined efforts aim to deliver timely, effective, and consistent care to reduce the risks and improve outcomes for people experiencing this neurological emergency worldwide. Always remember, individual cases can differ, so consulting healthcare professionals for personalized advice is essential.